Welcome, everybody, to another episode of the Health Movement Podcast. This is episode 6, and we're going to be talking about 5 myths in fitness. I'm Derek. I'm a certified personal trainer, as a 2-sport collegiate athlete, and I've been an elementary school teacher for over 23 years.
My name's Tim. I'm a certified athletic trainer, nationally registered EMT, weekend warrior. Weekend warrior.
Oh, yeah, you know it. And as we mention every week, we're not doctors, so obviously consult your physician before beginning any training exercises. What we thought we'd do this week is jump into the top 5 fitness myths, or maybe not top 5, but 5 big ones. Before we do, though, I wanted to give a quick shout out to my buddy Brock, who's in the Navy, stationed out in Japan, who just started listening to the show. I had a good conversation with him a few days ago, and just appreciate everything you're doing for us, Brock. So here's to you, buddy. All right, number 1, top 5 fitness myth. Cardio is the best way to lose weight. What do you think about that, Timmy?
I mean, I think the thing that gets lost is the resistance training, right? People think that weightlifting and resistance training strictly build muscle, right? And I think that's something where, and yeah, cardio is a decent way to lose weight, right? Especially if you're doing low intensity, tracking your heart rate, all that kind of stuff. And I think that's the biggest key, right? Is where are you at? Where's your heart rate sitting? Where are you in that cycle of being able to burn the most amount of calories in that zone, right? And I think that's an area where people think that you have to strictly do cardio to be able to lose weight. And I think that's something that not a lot of people understand isn't the case,
I know. I think a lot of people look at it too as a workout by workout comparison, where if you're doing some high intensity aerobic exercise for 30 minutes, 45 an hour, you're going to burn more calories in that instance when compared to a regular weight training session. But over time, especially with the body recomposition, as you're building more muscle, your metabolism is going to ramp up. So during a rested state, your body's going to be requiring more energy to just maintain yourself from a day-to-day perspective. So in that regard, building that muscle will help more long-term in terms of losing fat and losing body weight. So I think cardio is fine. It's good. You want aerobically to be healthy in terms of heart health and all that stuff too. But
I also think with the cardio, right? People think, you got to go balls to the wall and max effort and put all this effort into it, and that's not the case either, right? I think whether you hop on a treadmill and run at 10, I think you're better off putting it on 3.5 on a little bit of an incline and keeping your heart rate in that 120, 130 zone, and not really ramping up to that, max heart rate, or even like 85% of your heart rate, right? So you want to find that sweet spot of where your heart rate is, and try to maintain that over a steady state, and that steady state cardio is going to be more productive for you in that case than getting on and ripping 20 minutes of as fast as you possibly can. I think that's where people kind of lose the forest through the trees a little bit.
Yeah, I agree with that. And another thing too, with those high intensity workouts, you're much more likely to get injured doing something like that as opposed to a steady state activity that's going to be beneficial long term. But also if all you're doing is doing a half-hour cardio each day and going hard, and then you're sedentary the rest of the time, it's not going to have the benefit as an overall active lifestyle where you're getting your steps in that you need. You're parking farther away from the grocery store so you can get out and walk. You're taking the stairs instead of the elevator. Like, there are all these hacks that you can do that will add more movement to your life. So in terms of cardio being the best overall way to lose weight, I would think it's a combination of cardio as well as movement throughout the day and good resistance training to build muscle.
Mhm.
That's where I land on that one.
Well, and I think that's a good segue into the second one, right? Into the lifting weights makes you bulky, right? That's our
Yeah.
second myth here of
Myth number two,
uh,
lifting weights makes you huge.
what do you have to say about that? What are you
You know,
thinking on
to
that?
be honest, I wish that was the case. You know, where you're like, oh, I don't want to lift this heavy weight or I'm going to get too big. You know, I've been lifting weights for 20 years and I've never walked by a mirror and been like, oh man, I'm too jacked. Like, I don't want to look this big. But I get this question. I've gotten it from actually a few women lately. And I'm not saying it's just women who are concerned about this, but it just happens to be the one that I've spoken to where they're afraid to start lifting weights because they don't want to get too bulky. That's not The weights aren't going to get you bulky. If you want to put on weight and put on mass, you have to be in a caloric surplus, and it has to be over a decent amount of time. You're not going to put on 10 pounds of muscle and gain a ton of weight in a month or two. I mean, a lot of people, that's their goal, and they've been trying it for years, and it hasn't happened yet. So lifting weights, yes, that can lead to adding muscle mass, but you need to be fueling your body the right way, and you also need to be getting the sleep you need in order to turn that, to repair that muscle and add muscle growth.
And I think the other piece to that is doing that functionally, right? And making sure that you're not creating any imbalance or creating anything that's gonna put you in a spot where you have these asymmetries or imbalances that are gonna lead to aches and pains over time or chronic type of injury situations, right? So I think the big thing is just making sure that you're doing things correctly, you're staying balanced. That the big thing with weightlifting and just kind of resistance training in general is you want to make sure that whatever routine you're doing is full body. You don't want to, I think the days
Yeah.
of do chest day or back day or you want to, if you're moving and you're doing resistance training, you should be doing a more universal full body movement type of training, not just picking out certain muscle groups on a daily basis. I think if you're doing that kind of stuff, you should be trying to mix in some full body movement in there too, and trying to be a little bit more balanced with it.
Yeah, and I think that goes back to a lot of times we talk about what's your goal at the end of the day. Why are you doing this? And unless you're in a bodybuilding competition where your muscles are on display on the stage and you need to make sure that you've got that symmetrical look where every muscle group is hit perfectly. Doing full body movements, like you're saying, will get all the muscles that you need and make a huge difference. And if you notice, your hamstrings are weak and you need to do a little isolated work in the hamstrings, like great, do that. But full body movements, like you're saying, I think are the best in the long run anyway. So
Squeeze those glutes. Squeeze those glutes.
yeah.
I think that's the the one thing I see the most is people don't properly use the muscle groups correctly, and the glutes are one that it's one of the bigger muscles in your body. Once you start to get fatigued or you start to get tired, your body, your brain tries to conserve energy, right? So how do you conserve energy the best? You don't use a big muscle that's going to use a lot of energy, right? So that's one of the things that leads to muscle overuse. Not using your glutes can lead to back pain and overuse of your hamstring, and it's a snowball effect. So it's funny because when I was working in a college setting, I kind of got a rep of telling people like, hey, listen, you're not using that glute enough, but it's true, and it's something that you don't really notice it until you actually start using it or try to start using it and realize
Yeah.
how difficult it can be to even make that mind body connection of getting that muscle to fire. And that's not strictly to the glute, right? Like this is another thing of you don't really realize your imbalances until it's too late. And then and everybody loves to work on the things they're good at, right? Like you want to you go to the gym and it's fun to do the things that you're good, where you can lift a lot of weight and push a lot of weight and all that stuff. But at the end of the day, you need to work on the best thing for you is working on the things you need to work on and the things that are the weakest or the most underdeveloped and try to bring those along to where you can match the stuff that you're feeling good with too,
Yeah. And I think we went down a little bit of a little tangent on that one there. But it's all valuable at the end. So lifting weights makes people bulky. No, you can go heavier weights, and unless you're fueling your body the right way with that in mind, you're not gonna you'll add muscle, but you won't get, Dwayne the Rock Johnson size by doing some squats and some deadlifts and things like that. So all right, myth number 3, you need supplements to get fit. I'll throw that one at you, Timmy.
I mean, I think I say this to people all the time, is supplement is just that, right? It's in the word. It should be something that is in addition to what you are getting through your diet. So your diet and nutrition plan should be the number one source of where you're getting those micronutrients and those things that you may be getting through your supplements, right? I think the big thing with supplements is you need to make sure that you do your research. A lot of them aren't regulated, too intensely. So you need to make sure that you know where you're getting them from and what the source of them are. And, if it's NSA certified or something like that, that's probably your best source of making sure that you're getting something that is beneficial for you. With supplements, I always tell people, like, especially like me and you live in the Northeast, right? And we don't get a ton of sunlight in the year. So like something like a vitamin D or something like that, a multivitamin, I always say those are things that you can add in. I think creatine is a big one that people love to kind of hit a little bit. It's, it's kind of hit or miss. I mean, I think it's got benefit to it, but at the same time, it can add some. You're talking about the bulkiness that can, it does kind of swell the muscle with water a little bit, so it can you can feel a little bloated with that a little bit sometimes. So it's not a necessity to getting fit is using supplements. I think it's something that it can help you dial it in a little bit more, but I don't think it's absolutely necessary. I think it's more you
No.
need to get it through your diet first, and then use your supplements as exactly that, right?
Yeah, and you can get everything you need from natural food. Like you don't need supplements. The only time I would say it would be beneficial, mentioning the vitamin D, and I appreciate you pointing out how pasty white I look, even though it's still the end of summer. Yeah, awesome, thanks, pal. But you need some things, like if you're not getting your protein intake the way you want to, and you want to take some protein powder and have a protein shake to get those last 30 grams of protein in, like, sure, you can do that. But that should be, like you said, a supplement, not like the staple of your diet. And also, not all of them are built the same, as you said. A protein powder, a scoop, if it's pure protein, has about 100 calories in it. If your protein powder is pushing 150 to 180, there's so many extra additives in there that are going to make you feel kind of crappy, depending on who you are. I know there are certain ones that don't do well with my stomach. The one I take is, I can't think of the name off the top of my head, but it's got about 120 calories per scoop. So I know it's got a little extra something in there, but overall it's pretty clean. But I've definitely done research for what works for me, and I've tried a bunch of different kinds, and I know that's the one that works best for me. So that's something you have to kind of figure out for yourself. But you don't need supplements to get fit, unless you have some sort of vitamin deficiency or something like that. Then obviously get that in. But no, for the most part, you definitely don't.
All right, so on to number 4 here, right? So this is one that's I think it's got a little bit more of a vanity complex to it.
Yeah.
Crunches and other ab exercises are the best way to build abs, and I'll get into what I feel about this after, but I want to feel hear what you have to say.
Yeah. I'll jump in because my response covers the more superficial response, where if people want a good six pack, they're like, oh, I did the 8 minute abs, I did 500 crunches a day, and you're doing all this stuff, which can strengthen your core. You might not, it can strengthen it, but you're not going to see any abs unless your body fat percentage is low enough to show the abs. Like, you can do as many as you want, and if it's still covered by a wall of fat, you're not going to see anything. Well, there's a little hack you can do where if you add resistance to your ab workouts, it'll build the muscle like any other muscle in your body, and it might protrude through that layer of fat. So you wouldn't have to get as low a body fat percentage, but still overall, um, you're not going to see visible abs in men and women. It's slightly different with the body fat percentage, but most men it's going to be around 15%. 16 maybe till you see some visible abs there. In women, it's I think generally around 23-24%, but that one I'd have to double check for sure.
Yeah,
Um,
and I mean, I think it's the big thing with that is I don't know how many people are going to be able to successfully diet or dial in their nutrition to be able to do that in a healthy manner. So that's one of my big pet peeves with that. The other piece to it is if you have a six-pack ab and you have no idea how to functionally use your core, it doesn't mean anything anyways, right? So if you're not using your core correctly and you're not bracing and you're not able to support the other structures around your hips, your shoulders, and I think this is where people don't realize like core engagement and core stability are one of the foundational building blocks of what you should be doing for both resistance training and when you are doing any type of movement, you should be engaging your core, you should be bracing, having, working with someone to teach you how to be able to brace your core correctly it is, I go back to like the Olympic lifts. You talk about deadlifting or squats or power cleans or anything with those movements, right? You need to be engaging your core. You need to be what it does is it connects your upper and lower body, right? And those are things that I need to stop saying, right? I say it all the time. Um, but it helps with, it doesn't just help, it is a major factor in strength, power, but then also injury prevention, right? And those are things
yeah,
those are areas, I know, I catch it. I can't stop saying it. Um,
I say like, you say right,
yeah,
but
yeah.
we're
It's my,
acknowledging it.
it's my crutch. It's my crutch.
Yeah,
But, yeah, so it's a thing where, um, the vanity aspect is something that, and maybe that's just me because I've never had a six pack ab, probably never will, and that's just my body type too, right? And I think that's another piece to this too is people don't understand like your body type might not be to get to that body fat percentage. It might not be healthy for you, and that's okay too. And just because you don't have those abs doesn't mean that you're not fit or you're not gonna,
yeah.
hit a level of fitness that is good for you. So I think that's shouldn't be something that someone gets hung up on,
Yeah, I think in saying the engaging your core piece, when you're doing, especially those full body workouts, a squat or deadlift, or even like laying down on the bench and you're engaging your core as you're lifting the weights up, or even like a single arm inclined bench press or with a dumbbell, and you engage your core with that to try and help stability, like you don't necessarily need to isolate your ab muscles in a workout to strengthen them. They should be engaged in most exercises that you do.
and the like a posterior pelvic tilt. Like I don't know how many people that don't know how to correctly do a posterior pelvic tilt and be able to brace your core and keep your hips in pelvis in the alignment that you want without stressing certain joints or
When
your
you
lower
say
back.
posterior pelvic tilt, can you explain that to a friend like Nick that might not know exactly what that means?
So pelvic mechanics are fairly subtle, right? It's not like a shoulder movement where you can see or people know how to move. You got shoulder flexion, shoulder extension,
Yeah,
abduction, all those things, right? The pelvic mechanics are something where an anterior pelvic tilt is where I usually tell people like think of your hips as like a bowl of water, right? And you don't want to dump water out of the front of the bowl. And that's your anterior pelvic tilt. So being able to tilt your pelvis and get it to a more neutral position, it's not it. I say posterior pelvic tilt, but it's really just bringing it more to a neutral position, right? Those are things that you need to be working on and need to know how to do to be able to properly brace your core and be able to do some of the movements that we were just talking about and be able to do them safely and correctly. And I find a lot of people, especially if they have lower back pathologies, or again, we go back to that that pesky glute or the hip flexor. People get a lot of um, stiffness and tightness that lead to reduced mechanics of that pelvis, and it can lead to a lot of issues down the line. So that's those are places that you need to start. That needs to be your solid foundation to be able to brace your core correctly and be able to engage your core while you're exercising. And that's not just lifting, that's running and biking and all these other or even when you're driving in your car and not just slouching in your seat. And when you talk about posture, that's a big thing.
Yeah. All right. We're going to go on to number 5. This is the last one. Going to the gym every day is the best way to become fit.
I mean, we kind of covered this a little bit too, because find your movement, right? Find the movement that makes you happy, but also where you can get it in, right? It doesn't always have to be the gym. It doesn't have to be, some people can't get to the gym. So it's, you're talking about finding movement throughout the day of taking the stairs versus taking the elevator or the escalator, or, for me, it's, get out on a little bit of a walk, or try to find something, that is a way that you can work it into your schedule and you can work it into your day-to-day routine. And it's not a challenge.
Yeah. I think for me, and when I hear going in the gym, I was working out lifting weights 7 days a week. I would do a push day, which would be like a chest and tricep, a pull day, back and buys. I would do a leg day, and I'd throw some extra shoulders into the leg day, but it was like I wouldn't miss a day, and it felt good until about 3 months into it, when overtraining really hit and set in. And talking to one of my friends, she recently had elbow surgery on both elbows because same thing happened to her, and she was overdoing it so badly that she just ruined the tendons in both of her biceps, and she needed to go in for surgery on it.
And this goes back to our episode from last week, right? And we talk about the rest and recovery and how important that is to the process, right? And I think that's something that is overlooked, and especially if you're working with somebody that's highly motivated and has a high drive and is really active. It's hard to get people like that to dial it down a little bit on it. And again,
100%.
And it doesn't have to be like, oh, you're just sitting on the couch, that's your rest day. I think a good active recovery day is super beneficial and can be super helpful, and is necessary to be able to make gains and to be able to get to where you want to be, and to be able to be consistent. You need to be able to do that, or you're going to hit that wall like you're talking about, and it's not going to be fun.
No, and then the problem is, once you get those injuries, you need to either take months off to let it heal, if that's a way to go, or it's surgery, and then you're taking many, many months off, and it sets you back that much farther. And I think a lot of people are under the impression that you need 7 days. Well, maybe not a lot of people, but there are definitely some that think, 7 days of lifting is better than 5 days of lifting. And it's not. Your body needs the time to recover. You only need 3, 4, 5 tops days of lifting to see significant change. And if you're not seeing changes at 5 days, then something's wrong with your programming, or something's wrong with your nutrition. Or are you getting, 6, 7, 8 hours of sleep a night? Are you resting enough? So it's one of the 4 major parts of it that we talk about.
Diversify your movement too. You know what I mean? You need a variety of different movement, and if you stay in the same movement planes all the time, you're just gonna end up overtraining those specific movements, and you're not gonna be. I think the one thing I see is a lot of people don't train rotation. I think that's a thing that I see a lot is, we're rotational beings, and just because I think training rotation doesn't have to be, oh, I'm rotating my trunk, right? It's a suitcase carry. It's like a Palloff press, those kind of things that are more anti-rotation, but you're still training that rotational plane, right? And you're changing you're changing the line of pull. And I think those are things that those are areas that you can dial in a little bit more and make that a little bit more challenging. And I think that's the piece that I could kick your butt with a resistance band and,
Oh,
and some body
yeah,
weight movement, and you're going to feel it the next day. You know what I mean? So it doesn't necessarily have to be just resistance training that's going to get you to where you need to be. It's making sure that you're checking off those boxes of, again, we're talking about more of a subtle movement that you don't do as much in relation to, we're talking about pelvic mechanics before, but those subtle underutilized movements need to be trained, need to be worked on. And it's like, it's like movement hygiene stuff, right? It's like brushing your teeth or flossing your teeth, and you need to be able to do those things consistently to see the benefit over time.
yeah, yeah, definitely. And one other thing you said, and I can't remember what it was, but it made this jump in my head, is you should be tracking what you're doing when you're at the gym, whether it's paper and pen, whether you have an app or something like that. You want to make sure when you're going, you're getting the most out of it. If you're putting an hour at the gym, an hour in, and you don't need to do that much, but if you are, or whatever it happens to be, if you track what you're doing, you can see the progression throughout the weeks and the months, and you want to be able to see improvement in weight or rep or total volume or whatever it happens to be. So that's going to make a huge difference if you're not seeing the gains that you want to see. If you're not writing anything down or keeping track, it's going to be tough. I see a guy at the gym who is there all the time, consistent. I've never seen him miss a day, but he does the same exact thing every day. He's always got 185 pounds on the bench press. He always has the same weight on curls. He always has the same movements, and he goes in a circuit, which is fine, but he hasn't changed his rep range or his weight ever that I've seen. So he's going to get really good at that specific area and that specific rep range and that weight, but the muscle is never going to get stronger because you're not pushing it. Your body's never going to learn those different fundamental movements that you need because, like you said, you're really good in that one plane. But if you're not challenging it in other ways, it's never going to improve.
And it's great that he's consistent, right? I think that's a benefit, and something's better than nothing. But over time, it's just you're not going to get the same benefit out of it as you would to be able to add variety and change up the movement.
Yeah, and it's not in that instance, and I would love to say something to him, but I feel like for somebody like me, there's a very small population where I can actually say something and help somebody out. And I feel like it's the young guys who are just getting into the gym who might be like 18 to 22, where they might need help with something and I can say something and that's okay.
Yeah.
Nobody else really wants to hear it, and it's tough to make those suggestions, but this guy's working hard. Like, you can tell he's in there and he's giving it everything he has. It just, you need a little switch up with the programming. And this kind of leads me to a shameless plug. But if you guys need help, healthmovement.us is our website. There's a coaching tab on there. You can certainly fill it out to have a consult. We'd be happy to talk through what your goals are. If you have questions for the show, throw that in there as well. Because we want to make sure that we're covering topics and things that are important to people and that people need help with. So head over to the healthmovement.us website, or you can just leave a comment on whatever platform that you're listening to. And we'd be happy to make sure we cover those in future episodes as we get to it. Anything else on those, Tim? Or are we good with the myths?
No, I think we covered those pretty well. So.
All right. I did want to, I know I showed you this video before, but I love it. We do a lot of talk on how mindset is the most important piece of all this stuff. And I think that goes in all aspects of life. So this is Roman Reigns, who is a WWE superstar. I don't know what the acronym is these days, but this is a really cool way to think about negativity and all that stuff. So I'm going to play it. It's about 30 seconds. So just bear with us. And I don't know how the video shows up on YouTube. It seems a little scratchy, but the audio comes through clear. So here we go.
Imagine this: if you had $86,400 in your account and someone stole $10 from you, would you be upset and throw all of the remaining $86,390 away in hopes of getting back at the person who took your $10? Or move on and live? Definitely move on and live. See, we all have 86,400 seconds each day. Don't let someone's negative 10 seconds ruin the remaining 86,390. Don't sweat the small stuff. Life is bigger than that.
I love that. I love that approach and that mindset, because a lot of times that's what happens. Somebody makes one rude comment and it throws off your whole day, as opposed to all the good stuff that's been happening up until that point in time and even afterwards.
Yeah, I think that's something that I know I can work on for sure. And it's I think it's all about perspective, and it's hard in that moment too, right? I think you get all worked up, you get emotional about it, and I tend to be a pretty emotional person. I think we saw that in our final softball game.
I don't know what you're talking about.
But I think that's the thing is making sure that you control those emotions. Don't let those emotions control you, and that's something that I know I'm working on. So
Yeah. And there's, as I mentioned, I'm a teacher, and there's a book called Wonder. I don't know if you've ever read it. When your son gets a little older, it's an awesome book to read. But in it, it's a boy who goes away on a field trip with his class. It's for a whole weekend, and something happens, and he gets picked on by some bullies, and the whole instance lasts 2 minutes maybe. And he gets home, and his mom's talking to him. He's like, "You had an amazing 48 hours. Don't let those kids steal 2 minutes and ruin the whole experience for you, because there are so many good things that happen." So it's tough to make that mindset shift. Yeah, I said that
there we
right.
go. There we go. You got through it. You got through it.
I did. It took a minute, but it's tough to make that shift. But when you can, and you can keep things in perspective, most of your life, people are good to you. If you ask for help, most people are going to help you out. And the ones who are making the rude comments, generally, they've got other stuff going on that they're trying to deal with in their own life, and they're just projecting that crap onto you.
That's the biggest thing, right? Is projection. And I think you never know what someone else is going through. And I think a lot of the times when somebody's acting like that, it is more of a projection and says more about what they feel about themselves than what they actually feel about you, right? So that's always something to keep in mind as well. So
yeah.
The bloodline always. I know you don't watch wrestling, but the bloodline coming through there. That's Roman Reigns right there. I love that.
Yeah, I don't know what you mean by the bloodline coming through, but some of our listeners, I'm sure, will. So that will speak.
Yeah, that's like the new Rock, Roman Reigns like type of like they're the heels kind of in the wrestling world right now. Hey, wrestling's on a resurgence right now. There's a big
I'm not knocking it. I'm not knocking it at all.
My buddy Tom will appreciate that. He's we were talking about it at our fantasy drafts the other night about the resurgence of wrestling coming back from the Attitude Era from the late 90s, early 2000s. That was really for me, that was the heyday of wrestling. So not to I digress, but that's something that
well, maybe one of these days we'll get Roman on with us, and he can talk through his perspective there. I'm sure he's dying to get on the show.
I can't wait.
If we have time.
Yeah,
we'll
for
see
sure.
If we have time for him.
But Dwayne too. We'll get Dwayne on here.
Yeah, if we find it's valuable to the listeners, I don't know. See if he makes the cut or not.
That's the second Rock shout out we've had in this show too. So maybe we'll get to him at some point.
All right. We're going to go on to our next segment, which is the Take It or Leave It segment. And we'll do these quickly because looking at the time, we're getting closer to the end there. So take it or leave it. It's possible to build muscle and lose fat at the same time.
I mean, yeah, you can. Yeah, I'm going to take that. You know what I mean? I think they kind of coincide, right? Building muscle will help you lose fat. You kind of touched on it a little bit earlier with the cardio question, right? Or the myth. So I think that's something that they kind of correlate, and that it's something that they go hand in hand a little bit too. So I think those are areas that definitely are beneficial.
Yeah, and I'm gonna agree for the most part. I mean, you're not putting on 30 pounds of muscle and losing a lot of fat at the same time. Depending on how much you want to gain, you need a caloric surplus to really put some on, but you can certainly lose fat and gain muscle at the same time, provided your nutrition's dialed in, as well as your recovery and the programming is good. So yeah, I'll take that too. A lot of people will tell you can't do it, but I've certainly experienced it myself, so I know I know it's possible. So we kind of hit number 2 here
Yeah, I was thinking that
with
too.
one of the myths, but I guess this will be quick. You should do resistance training every day.
Yeah, I mean that's something that I'm gonna leave that, and this is just goes back to what I was saying earlier. Like you can you can get everything done you need to on a recovery day that an active recovery day, and adding those in to make sure that you're getting the gains you are or you want when you are resistance training. So I don't think, and you shouldn't be doing that every day to get to where you
No.
need to be. So I'm gonna absolutely leave that.
Yeah, I'm 100% leaving that too. Resistance training every day leads to overtraining and leads to injury, and then you're set back a ton. It doesn't give the muscles time to heal and recover. So I'm definitely leaving that one. That took me a while to learn too, because I assume like everybody else, the more you do, the better. And there's a point where you're at the perfect balance of resistance training versus
Well,
recovery.
and I think resistance training is a broad umbrella term, right? So like it's one of those things where you, it's all about your level of you know you hear that?
A little bit, it's fine.
Okay. Yeah. So it just your level of resistance training can be different, right? You don't always have to hammer the weight to get the outcome that you're looking for too. So not just every day, but also like the intensity can be changed up too.
So for number 3, take it or leave it. Should you weigh yourself daily to track progress?
I'm absolutely going to leave that. I think that's something that, first of all, you're going to get hyper focused on it and you're going to obsess about it. And second of all, the scale shouldn't give you I mean, it should a little bit. It should guide you, maybe weekly weigh-ins or bi-weekly weigh-ins, something like that. You can start to track the progress a little bit that way. But the biggest thing is, and I tell this to people too, is look in the mirror and you'll start to see more change there than you will on the scale. And muscle weighs more than fat, right? So if you're looking to lose weight and to gain muscle and that's your goal, then you might even gain weight initially more so than lose weight, right? So those are things that I think looking at yourself in the mirror and how you look and how you more importantly, like, yeah, how you look is, again, that's a little bit more vain. It's more about how you feel. And you're going to start to see a lot more change in how you feel on a day-to-day basis.
Yeah, we probably should put some in here where we're not both agreeing with the same side of it, but I would 100% leave this. And like you said, sometimes you need it. Like, if you have a significant amount of weight to lose, you're going to need to track that as one of your metrics, but not something you want to check every day. Progress photos, I think, are some of the best barometers of where you are in terms of body recomposition, because you're going to see the changes there. And also body fat percentage. I've had a couple clients tell me what their body fat percentage is listed at, and I'll look at a picture and you can tell it's way off. Like it could be 5% less than what they're thinking, because, one of them was taking it with their watch, and that's not watch, or even like those scales that you just stand on. They're not always accurate. Usually they're consistent, so wherever they are, you can use that to see what you've gained and what you've lost. But nothing's going to beat putting on a pair of pants that's a little tight, and then as you start changing, you'll notice they fit differently. And again, how you feel too. If you feel good, chances are your composition is changing significantly, and that's going to be the biggest thing. But like checking once a week, I think is fine. If you check every day, a lot of things can factor into, you've had a lot of sodium the day before, so your water retention is higher. Little things like that, and it just maybe built some muscle too. And like you said, it weighs more than fat. So you don't want to be tied to the scale, because that's gonna make you feel like you're not progressing the way you should, and a lot of times that's not right. All right, we'll hit listener questions now. We just got one for today that we missed last week. Sorry about that, Nick. That's our boy. But the question here is, my work is very physical, requiring me to lift a lot of different things throughout the day. over the years, my shoulders have really started to hurt and bother me to the point it's affecting my everyday life. What should I do?
Well, I think this is one that can be a little bit more difficult, right? Because without getting my hands on somebody and being able to check what their functional range of motion is, or be able to try to rule out any specific pathology. So this is again where this is more of a general approach than a specific case approach. But I think the biggest thing is working on shoulder stability, scapular stability. Especially in today's world, like we tend to be, you get the tech neck or you get the rounded shoulders, and we don't, again, talking about that imbalance, you're talking about the shoulder not doing, it's a complex muscle, right? Your scapula is your shoulder blade moves in all 360 degrees. It's one of the only joints in your body that does that. So it's really hard to stabilize. So that's a thing where working on mobility is huge. Soft tissue is another one that people don't get enough soft tissue work done. They don't do enough soft tissue work on their own. So that's an area where, I think you need to really check those boxes on a daily basis to be able to avoid that long-term overuse of, it tends to be the bigger muscles take over, the smaller muscles shut off, and that's where you create that imbalance. And then the more you use it, the more that imbalance grows or strengthens, right? So you need to work on checking off the boxes to, again, work on the stuff that's hard, right? And knowing how to feel and knowing how to engage your muscles correctly and doing things ergonomically friendly or friendly to how you need to do it is important. So, again, without getting too specific or being, knowing the case too intently, I think that's a good rule of thumb for anybody that's going to be, works in a physical job. I work a lot with construction workers, and it's teaching them how to use their shoulders correctly, not being here and having it in toward your body a little bit more, and not overusing your rotator cuff, or making sure that you do use some of the bigger muscles sometimes too correctly, and that's I think this is one that I could probably go down a little bit of a wormhole on, so I'm just going to try to keep it a little bit more broad. But Nick, hit a foam roller once in a while too, Nick. You know what I mean?
Foam roller, yeah. You would recommend him having it, like having somebody work on it, having somebody check it out to see what specifically it is?
Yeah. And again, like, what's the functional range of motion? What's the internal rotation look like? What's the external rotation look like? Where is his pain? What's his pain level? What's causing it? You know what I mean? Is it a specific pathology that's a muscle tear, or something that's actually an issue, or is it just overuse and tightness that the brain is just telling them, like, hey, this is getting worked a little bit too hard and you need to back off a little bit too. So it's all case dependent. It all depends on what the situation is. And, it sounds like if it's both shoulders, it probably is more of a muscle overuse thing, but you can't get too specific and talk about, specific cases without knowing and seeing and actually putting somebody through, a movement profile and understand like what their movement is like,
Gotcha. Well, that brings us to the end of this episode, and I got to tell you, like, I love dorking out and talking about this stuff for 45 minutes to an hour each week. If you guys have questions or things you want us to cover, please reach out, because we want to make sure this is beneficial to all of you. I mean, as you can tell, we can kind of go down a rabbit hole sometimes, but that's just part of it. So reach out to us, healthmovement.us. Leave comments in the comment section wherever you happen to listen to this: YouTube, Spotify, Apple Podcasts, wherever it is.
Tell your friends, tell your family, tell your loved ones. Get people listening, right?
Yeah, we're in 7 countries right now. Hopefully by this time next week we can report out we're in 10 to 15. That would be nice. But we hit Jamaica, Japan, Sweden, across the globe. So we're enjoying that.
Awesome.
All right. Everybody have a good one.
Take care.